Department Director, Janelle Lynn.
Good morning, Chairman and members of the board. I have a quick COVID update for you today. As far as numbers go for Navajo County, we're up to 15,765 cases of confirmed or probable COVID. 6,612 of those have been worked by our Navajo County public health nurses. Our numbers continue to remain very low. We only had 8 cases reported to us in the last 24 hours and 2 new cases the 24 hours prior to that. So that's very encouraging and news to us, and we're very happy to see that. We're currently monitoring 69 households of individuals who are either infected or a direct exposure to a COVID case. So those numbers are also very low. To date, we've had 1,594 people in Navajo County who have been hospitalized due to a COVID infection and 505 COVID-related deaths. To date, we've had 577 school-related cases, so that's a staff member or a student case that's linked directly back to a school. Today, there's an 18% hospital bed capacity, meaning that 82% of the beds are full and 18% capacity. So there's still a little concerning on our bed capacity at hospitals. However, only 11% of the hospital beds in Arizona being utilized are due to COVID cases. So most of that's due to things that are non-COVID related. As far as vaccine goes, we're continuing to steadily receive around 2,000 to 2,500 doses of vaccine being allocated to Navajo County each week. Our vaccine coverage rates, we're impressed with those. The nation's vaccine coverage rate is 9.2%. And in Navajo County, we've had 23,958 individuals be vaccinated against COVID. 16,174 of those are people who have started their first dose, and 7,841 individuals have completed their 2-dose series of vaccine. So this is a 14.3% vaccine coverage rate. So compared to the national rate of 9.2, we're really pleased with those numbers. We have had almost 0 wastage in Navajo County. We're actually at 103.7% for doses utilized. So since we're able to get extra doses from some vials of vaccine, some vials have a little extra in there, we're actually above 100% for doses utilized. So we're really happy about that. Right now, the 55 and older population, we have opened that to vaccine eligibility. So if you're 55 and older, you can now receive a vaccine. You would continue to register through the website. There's a link on our county website that you can register. And some of our facility partners also have waiting lists that you can call and get on the waiting list. And when they have an appointment available, they will reach out to you to schedule that. We have a new vaccine that's come into the market last week and this week. It's the Johnson & Johnson product. It's called the Janssen vaccine. We've had a lot of questions about this vaccine. It is a little bit different than the vaccines that we have been using and are more used to in our county. This is a refrigerated vaccine. It's a 1-dose series, so it's a one and done. You don't need to come back and get a second shot. So that may be something that is appealing to many of you, that you don't have to worry about trying to get a second dose. There's some confusion on efficacy rates. We've had a lot of questions about efficacy rates. The Moderna and Pfizer vaccines have 90 to 94% overall efficacy rate, and the Janssen vaccine has 64 to 70 or 66 to 74% efficacy rate. So there's been some confusion there. What we really want to stress is that comparing those products neck to neck can be confusing, and it's really not a fair assessment. The trials were done differently with different study groups. They were done in different parts of the world where there could have been different strains circulating. So to compare them one against the other is not really an adequate assessment. The CDC is making no preference over one dose or another. Their recommendation is if you have access to a dose and you want to be vaccinated, you should take it. So the Johnson & Johnson product is very effective against preventing hospitalizations and death. So it's 93% effective against preventing hospitalization, which means even if you contract COVID, your symptoms are going to 93% of the time be adequately covered where you don't end up in the hospital. And it's been 100% effective against mortality or death. So our ultimate goal here is that even if we catch COVID, to not get so sick we end up in the hospital or, worse. So it's still very effective as far as looking at those considerations. There was guidance released late yesterday from the CDC for fully vaccinated individuals. So fully vaccinated means if you have the 2-dose series that you are 2 weeks past your second dose of vaccine, or if you receive the 1-dose series that you're 2 weeks past your 1 dose of vaccine. That's a fully vaccinated individual. And so this guidance is kind of encouraging, kind of not. It basically lets us know that fully vaccinated people can be a little less cautious when gathering indoors as far as wearing a mask. If the whole room or a large portion of the room is fully vaccinated, you would still need to social distance 6 feet apart. However, you wouldn't necessarily need to wear your mask. So this can be helpful for family gatherings. This can start to become helpful in the workplace and places of employment. If you have a high percentage of your employees who are fully vaccinated and considered low risk, in that low risk means when they're out in the community, they're practicing that mask wearing, social distancing, and mitigation strategies. It also specifies that if you're staying 6 feet apart without wearing your mask, you can interact with, say, maybe your neighbor, your next door neighbor, if you're just kind of maintaining some social distancing pieces. So it's given us some flexibility with mask wearing. It also specifies that individuals who are fully vaccinated can now refrain from quarantine and testing as long as they remain symptom-free from COVID. In the past, there was a specific 90-day post-vaccination piece earmarked to that guidance. That has been removed. So that's encouraging to us as well. So some of the things that have not changed are that when we're in large public gatherings, we should still be wearing our masks. When we're out in the public in general, please, we encourage you to continue to wear your mask. Gathering with large numbers of unvaccinated individuals, we still encourage you to approach that with caution, and especially if you're at high risk for disease or a poor outcome. There are still many unknowns about COVID. It's something that's being monitored all the time as far as vaccine efficacy, how long are those antibodies carrying people, so how long are we going to go before we may need a booster dose of vaccine, or are they going to continue all the time to broaden and expand and bring those things such as mask wearing considerations down so that we can move into more of our day-to-day routine and back to our, for lack of a better word, our normal. So those are some just kind of highlights from the CDC's updated guidance yesterday. Also on Friday, the governor issued a new executive order. There's been a little confusion around that. It lifted occupancy limits for some facilities such as gyms, theaters, restaurants. However, the mitigation strategies that were given to us in August of 2020 and October of 2020 are still in place. And those mitigation strategies include things like social distancing of 6 feet or greater and mask wearing. So for many of our restaurants and businesses like that, it's not really going to change things, because in order to maintain that 6 foot distance, you still really can't go up to your maximum occupancy. So we are just wanting to stress to especially our restaurant partners or businesses like that to really take those things into consideration. This executive order does not mean that everything was just lifted and returned to normal day-to-day business. You still need to refer to those same mitigation strategies. Where this may impact things and broaden things are at, say, sporting events. There's no longer like occupancy limits. But you still do need to maintain those social distancing, those plans. The authority still remains at the local town or city level. You would still need to, for events larger than 50 people, submit your mitigation plan for approval to your local town or city. So there's been some confusion surrounding that executive order, and we just wanted to clarify some of those things today. And that's our update.
Thank you, Janelle.